Assalamualaikum, Tom. How are you, Abira? Okay, good. Alhamdulillah, I'm good too. So let us start our today's class. Beta, today is lecture number 8 of your subject health and safety in health and social care workplace. Yes, health and safety in the health and social care workplace. Today we are going to complete our learning outcome number 2, that is understand the ways in which health and safety requirements impact on customers and the work of practitioner in the health and social care workplace. So in learning outcome number 2, if you remember which topics we have covered, let us see them one by one. We have covered the risk assessment, risk management, the impact of one aspect of health and safety policy on health and social care practices. And today we are going to discuss the dilemmas encountered in relation to implementing the systems and policies for health, safety, and security, and analyze the effect of non-compliance with health and safety. So in previous lecture, we discussed one dilemma, okay, and we are going to continue the remaining all kinds of dilemmas that are usually encountered while you know encountering the implementation of health and safety procedures in any workplace. Okay, so objectives of today's class is to make you understand the aspect of health and safety policy, because we are going to implement the health and safety policy in any workplace. So we should know that what kind of risk can happen, how will we manage the risk occurrence, and what kind of dilemmas can happen, and how we will deal with such dilemmas. Okay, so what is dilemma? Just a review, or you can say, let us recap what is dilemma. A dilemma is a situation where an individual or organization is faced with two or more conflicting options or choices, each of which has its own advantages and disadvantages. In the context of implementing systems, policies for health, safety, and security, dilemmas can arise when there is a conflict between different objectives, priorities, or values. Okay, so basically, it is a situation where any organization or the object, whether it be an individual person or any organization, usually faced with two or more conflicting options or choices, and each of the choice or the option has its own advantages as well as disadvantages. So it becomes very difficult for that object to decide which condition to should be chosen, or which choice should be given priority while implementation. Okay, so we have discussed one dilemma before, and now we are going to discuss the second dilemma, that is balancing the risk against benefit. The first dilemma was determining and taking responsibility. Okay, balancing risk against benefits. Balancing risk against benefits is another common dilemma encountered in relation to implementing systems and policies for health, safety, and security. This dilemma often arises when there is a trade off between the potential benefits of a policy or intervention and the potential risks associated with it. Okay, so okay, just keep in mind that all the things that we are going to discuss today is related to the implementation of the health and safety policy. Okay, whether they are dilemmas, whether they are risks or hurdles, okay, everything is related to or as a result of implementation of health and safety policy. So balancing risk against benefit is another dilemma which is most commonly encountered while implementation, and it arises when there is a trade off between the benefits and the potential risks. For example, in a healthcare setting, there may be a need to use certain medications or procedures to treat a patient's condition, but these may have potential side effects or risks. In such cases, it is important to weigh the potential benefits against the potential risks and make a decision that minimizes harm and maximizes the potential benefits. Okay, so here the example is given related to the treatment of a patient, treatment with certain oral medications, in which the oral medications no doubt has have some kind of benefits, but along with these benefits, these oral medications may have some potential side effects as well. So, in such case, we will judge whether the benefits are more important than the risks that will occur as a result of using such medicines, or the potential risks are much severe as compared to the benefit. Okay, so our priority will be that there should be lesser harm, lesser side effects, and there should be more potential benefits of our treatment regime. So, depending upon this criteria, we will decide whether we are going to give certain medicines, oral medicines, to a patient or not. Okay. So, sometimes, usually, a tablet or any capsule has more benefits as compared to its side effects, and usually these side effects are masked during the treatment plan due to the presence of a number or variety of benefits. So we will, in this case, usually in such cases, we decide to give that medicine to the patient. To address this dilemma, it is important to adopt a risk management approach that takes into account the potential benefits and the risks associated with the policies and interventions. Okay, so for the management of such kind of risk, usually what we do, we will consider the benefits as well as the risk related or associated with the policy or procedure or any other thing that we are going to implement in our workplace. So first point is conducting, this is basically a plan that should be kept in mind while implementing any policy or procedure. Conducting risk management, yes, it is very important thing or important step, and usually it is involved in all kind of dilemmas. Okay, first one is conducting a risk management. Conducting a comprehensive risk assessment to identify potential risks and benefits associated with the policies and interventions. This may involve evaluating the likelihood and severity of the potential risks and benefits, and identifying the strategies to mitigate or manage these risks. So, it is a complete process. Risk assessment and management is a complete process, and it is involved in the management of all kind of dilemmas in any health and safety workplace. So it includes, first is assessment of risk, and the judgment between the potential risk and the benefits associated with the policy. So third one is, if there is likelihood of occurrence of any risk or any hurdle, then how that risk will be managed as a result of implementation of the policy. Okay, and finally, to judge between the benefits and the risk. If the benefits are more, if by as a result of implementation of policy we get more benefits, then of course we will finally implement it in our workplace, no matter how many risks can occur as a result of implementation. Involving stakeholders. Engaging with stakeholders such as patients, caregivers, and healthcare professionals, all the persons that are involved in the complete plan, in the complete regime. Maybe they are the person who are basically financing the process, or the person who are aiding the process by giving their expertise, or the person who are basically involved in providing a platform for giving the expertise and for giving the financial assistance. All these persons are known as stakeholders. Why the patients are come under the category of stakeholders? Because they are paying for their treatment. Okay, they are financing the institution, and caregivers and the healthcare professionals, they are giving up their giving providing us with their expertise. So they are also stakeholders. Okay, so engaging the stakeholders to understand their perspectives on potential benefits and risk associated with policies and interventions. This can help to ensure that decisions are informed by the needs and preferences of those affected by the policies and interventions. Okay, so whenever there is a possibility of occurrence of any risk or any hurdle or any side effect, of course, it means that stakeholders are directly involved. Stakeholders related to the health and safety workplace, okay? Health and safety institutions or the organizations. So, in such kind of organizations, the stakeholders are caregivers, care providers, healthcare professionals, and the patients. Okay, so it is very important to involve all of them in analyzing the benefits versus the risk of any policy. Because patients are going through the condition, they are taking the medicine. So everything that is occurring is inside their body. The treatment is producing the side effects in their body, the treatment is producing the benefits in their body. So it is very important to involve the patient along with the professionals, because professionals are the one who are supervising the occurrence of side effects and risks or and the benefits, while the patients are the one whose body is going through all this process. Okay, so first is conducting a risk assessment, second is involving stakeholders, third is adopting the evidence based practices. Adopting evidence based practices that have been shown to effective in achieving the desired outcomes while minimizing the potential risks. This may involve reviewing the latest research and guidelines and seeking expert advice where necessary. Okay, so evidence based practices means all the latest research, the latest, you can say, the written work that has been done on any medicine, on any procedure, all these things are involved in evidence based practice. Sometimes physicians don't let the patient undergo their research either, rather, they study the research related to their treatment plan, and then they prescribe the medicine to the patient. Monitoring and evaluation. Monitoring and evaluating policies and interventions to assess their effectiveness and any unintended consequences. This can help to identify any potential risks or benefits that were not identified during the risk assessment and make necessary adjustment to policies and interventions. Because sometimes when we go through all the research, all the evidences, or the and all the analysis that has been present already in the, you can say, in any book or online or at any website, we go through all the research and then we implement the policy, the treatment plan, any procedure on the basis of our research. But after implementation, we tend to identify that there are some other potential risks as well, or maybe there are some other benefits of the process or the procedure as well. Okay, then after that, we analyze our research again. Then we make the necessary adjustment, the necessary management that is required for the proper implementation of the procedure. So overall, addressing the dilemma of balancing risk against benefits requires a comprehensive and evidence-based risk management approach that takes into account the potential benefits and risk associated with the policies and interventions. Involves stakeholders, adopt evidence-based practices, and monitors and evaluates the policies and interventions. By doing so, stakeholders can work together to ensure that policies and interventions are effective in achieving their intended outcomes while minimizing the potential risks. So, this was all about balancing risk against benefits. Now, the third dilemma is resistance of service users, carers, and others in compliance. So, who are service user, carers, and healthcare providers? All of them are stakeholders. Resistance of service users, carers, and others in compliance is another common dilemma encountered in relation to implementing the systems and policies for health, safety, and security. Resistance can manifest in different forms, such as non-compliance, avoidance, or active resistance to policies and interventions. So when we are we are going to talk about the stakeholders, it also involves the patients themselves as well. So when we are saying that resistance of service users, it means the resistance of the patients. Now, resistance include the non-compliance. For example, if the treatment plan is not working efficiently on patient or not producing uh, the good outcomes on the disease of the patient, then usually it is termed as non-compliance. In such cases, the patient verbally deny to continue the treatment plan. Avoidance, for example, avoidance means if the patient is afraid of getting injections or injectables or other IV solutions, then this is known as avoidance. Or active resistance to policies and interventions. And if the patient altogether actively deny every kind of treatment plan, whether it be oral medicine, whether it be injectables, and by policies, mean if, for example, some kind of policies have been made related to the discipline matter, related to the hygienic conditions or some other conditions, and the patient actively deny to follow all the policies, then this is known as active resistance. Resistance can arise for various reasons, such as lack of understanding of the rationale behind policies, fear of change, or a sense of powerlessness or lack of control. Resistance can also be exacerbated by the factors such as cultural differences, language barriers, or past negative experiences with healthcare services. Okay, so why do resistance occur? They may be lack of understanding. The service users are unable to understand what kind of procedure the hospital or the organization is going to implement, and lack of understanding of the rationale behind the policies. They are unaware of the benefits of such policies, fear of change, because they are unable to accept the change. They have been stuck to the previous procedure and they are not ready to adopt the change. Or sense of powerlessness or lack of control, because they are afraid of change, so of course they will fear that they may suffer again while having a change in their treatment plan or change in the policy or any other procedure. Okay, why do resistance occurs, or why do the service users resist to adapt to the new policies, or more you can say better policies or the procedures? Why? Because there may be cultural differences. Okay, if a person is from the rural area and he has got admitted in any city or any a remote area, then of course he may fear from the machinery, the equipments, the instruments, the procedures that are present in the hospital. Because usually the hospitals that are present in the rural area, they are not equipped with the high tech machinery, so it will be new for him. Language barriers, yes, of course, even when if we not talk about the uh, across the country or across the border cultural differences or the language barrier, within a country there is language barrier also. How? A person from the rural area, he doesn't know how to communicate with the uh, uh, doctors, physicians, or the other persons living in a remote city. Languages of both persons can be different, or past negative experiences with the healthcare services, or if he has some past bad experience related to the healthcare services in the remote area, then of course he will also resist again. To address this dilemma, it is important to adopt a person-centered approach that takes into account the perspectives, needs, and preferences of service users, carers, and others. This may involve, of course, this is person-centered approach. Okay, resistance is totally a person-centered approach. Engaging with service users and carers to understand their perspective, concerns, and needs, and involving them in the development and implementation of policies and interventions. Okay, so one of the best way to reduce this kind of resistance is to engage the patient, engage the service user in the treatment plan. Okay, the physician, the service providers, they should tell each and every perspective, the need, requirement, the concerns, everything regarding the treatment plan to the service users or the carers. This can help to build the trust and address many any misunderstandings or misconceptions and ensure that policies and interventions are tailored to the needs and preferences of those affected by them. Okay, as a result of this, of course, there will be trust building between the service user and the service provider. And if there are some kind of misconceptions in patient's mind, of course, they will be omitted by such kind of engagement. Second is providing the clear and accessible information. Providing clear and accessible information about policies and interventions, including the rationale behind them, potential benefits, and any risks or side effects. This can help to increase the understanding and reduce the fear or uncertainty. So, first, we have intimated the patient regarding the concerns, the importance, the perspectives, and the requirements of the treatment regime. And now we are going to tell the service user regarding all the potential benefits, all the risks, side effects that may occur during the treatment, and the importance of this treatment plan or the priority of this treatment plan above others. Okay, so we are going to tell each and every point of view of the treatment plan to the patient. As a result of this, of course, it will reduce the fear of the patient. Providing support and training to service users and carers and others to help them comply with the policies and interventions. This may involve providing training on infection control practices, risk assessment, or medication management, and providing practical support such as transportation or language interpretation services. Okay, by providing support and training does not only mean that we are going to verbally support the patient. We are just going to enhance the knowledge of the patient regarding the risks, the benefits of the treatment plan. But if the patient requires, we are going to aid him or her in terms of the language services and also the transportation services as well. This will, of course, increase the output of the treatment. Using motivational interviewing techniques to help service users and carers identify their own reasons for complying with the policies and interventions and to overcome any barriers to compliance. And this can help to promote a sense of ownership and empowerment and increase motivation to comply. Okay. So, why the motivational interviewing techniques help the service users? Because as a result of motivational interviewing techniques, we are giving the opportunity to the patient to speak up freely regarding any point of treatment plan, regarding the implementation of any policy, regarding the hygiene of the area in which he is living. So, as a result of which, it will develop a sense of ownership, okay, in patient. By engaging with service users and carers, providing clear and accessible information, providing support and training, and using motivational interviewing techniques, stakeholders can work together to promote their compliance and ensure that policies and interventions are effective in achieving their intended outcomes. So, this is what we have discussed just now. Okay, then being over or under protective of service users. Being over or underprotective of service users is another common dilemma encountered in relation to implementing systems and policies for health, safety, and security. This dilemma arises when there is a need to balance the protection of service users with their autonomy and independency. Okay, so being overprotective or being underprotective of service user. It is one of kind of another dilemma which is usually encountered while implementing any policy or the procedure in, of course, health and safety workplace. So this dilemma arises when it becomes necessary to balance the protection of service users, okay, with their independence, along with their independence. Being overprotective of service users can result in loss of independence and dignity, and can limit their ability to make their own decisions and take risks. On the other hand, being underprotective can result in harm or injury of service users and can lead to legal and ethical consequences for care providers. Okay, so being overprotective and being underprotective, this is another kind of dilemma. Of how this dilemma occurs or why this occurs, being overprotective means service user is more than required concerned regarding his treatment plan. So as a result of which, because he is deciding his, he's contributing more in deciding the treatment plan, as a result of which he may suffer through many risks or hurdles. And this kind of independence may also result in, bad results, may cause bad results, while being underprotective, they can result in harm or injury of the service user. Why? Because he is least bothered or least concerned about his protection, about his well-being. So of course it can lead to some unethical consequences, of course. To address this dilemma, it is important to adopt a balanced approach that takes into account the unique needs, preferences, and abilities of service users. This may involve conducting a comprehensive risk assessment. Yes, again, as I have told you earlier, that this point should come in all dilemmas, the management of all dilemmas. Conducting a comprehensive risk assessment to identify potential risks and benefits associated with different activities and interventions. This can help to identify appropriate levels of protection and support for service users while minimizing the potential risks. So, first is, of course, assessment of risk, then comes the management of risk. Okay. Encouraging and supporting independence, encouraging and supporting service users to make their own decisions and take risks within a safe and supported environment. This can help to promote independence, dignity, and a sense of control for service users. Okay, why independence should be supported and encouraged? Because it gives confidence to the patient. He becomes confident enough to make his own decisions, to make his own choices, as a result of which, of course, he must feel more independent, more dignified, and there should be a sense of control developed as a result of this sport. Providing appropriate protection and support. Providing the appropriate protection and support to service users based on their individual needs and abilities. This may involve providing physical and cognitive support, such as mobility aids or communication devices, and providing supervision or monitoring where necessary. Providing appropriate protection and support involve providing some kind of aid to the patients depending upon their needs. For example, if a person is unable to move freely, okay, so mobility aids should be provided to him. If a person can't hear properly, can't speak properly, then communication devices should be provided to him. And if he is mentally unstable to a little level, then of course supervision is required, proper monitoring is required, and sometimes counseling is also required. So, in this way, not only the support, but the protection, proper protection is also given to the patient. So, depending upon their physical abilities. Involving service users in decision making, involving service users in decision making about their care and treatment and respecting their choices and preferences. This can help to promote a sense of autonomy and control for service users. Okay, As we have discussed it many times, that involvement of service users, engagement of service users is very important, rather very crucial in determining the treatment plan, because they can tell their own choices, they can tell their sensitivities, their hypersensitivities, their the ease, the extent of ease of any treatment plan as well. So it is very important to involve service users in deciding their treatment plans or treatment regimes. So overall, addressing the dilemma of being over to underprotective of service users require a balanced and person-centered approach. Balanced and person-centered approach that takes into account the unique needs, preferences, and abilities of each service user. By conducting a comprehensive risk assessment, encouraging and supporting independence, providing appropriate protection and support, and involving service users in decision making, stakeholders can work together to promote the safety, dignity, and autonomy of service users. So, this is just summary of all the points that we have discussed right now regarding to the dilemma. Okay, fifth one is providing adequate resources to meet health and safety needs. Providing adequate resources to meet health and safety needs is a critical aspect of implementing the systems and policies for health, safety, and security. However, resources constraints are a common dilemma encountered in healthcare settings, particularly in resource limited environments. Okay, so after everything, when we have discussed the involvement of all kind of stakeholders, whether they be service providers or the service users, the next point that is very important is the provision of adequate resources. Because if the proper resources are not present in any institution or in any organization, even then the institution will be unable to provide the proper care or proper support or proper treatment to the service users. Inadequate resources can lead to a range of negative consequences, including increased risk of harm or injury to service users, increased workload, stress for care providers, and reduced quality of care. Additionally, inadequate resources can lead to non compliance with the policies and interventions, which can further increase the risk of harm or injury. Okay, so when resources are not present, enough resources are not present in any institution, then of course it will lead to lesser trust, non compliance, and you can say non professional approach, and increased workload, increased stress for care providers. Because no doubt, if a number of competent professionals are present in any organization, but the resources are not sufficient for conducting any kind of procedure, then of course the competency of physicians will not come into account, or it will be useless, because they are not able to show their efficiency or competency in a proper way. So also because uh, inadequate resources also lead to non-compliance with the policies and interventions, as a result of which the risk of harm or injury will increase, and after some time maybe the institution will be shut down by the higher authorities, because enough resources are not present, so the institution will not be trusted in future regarding their treatment. To address this dilemma, it is important to adopt a proactive and collaborative approach that involves the stakeholders, including service users, care providers, and policy makers. This may involve conducting a needs assessment to identify the health and safety needs of service users and the resources required to meet those needs. This can help to prioritize the resource allocation and ensure that the resources are used effectively and efficiently. The needs assessment is very important because resources are not proper, they are, you can say, inadequate resources are present. So it is important to carry out a need assessment procedure in order to understand that what kind of resources are required in the organization so that they can be used effectively and efficiently. Advocating for adequate resources at all levels of healthcare system, including government funding, donations, and grants. This can involve working with the policymakers, professional associations, and other stakeholders to raise awareness of the importance of health and safety and to secure funding and resources. In order to advocate or in order to speak up for the provision of adequate resources, the first thing that comes in mind is the financial aiding. And for that, of course, and the institution will ask about the government funding, the donations, the grants from other organizations, and of course, it will involve the policymakers and the professional associations as well. Because now the organization is taking a step ahead to provide the or equip the institution with the adequate resources. Collaborating with other organizations. Collaborating with other healthcare organizations, community groups, and volunteers to share resources and expertise and to leverage the resources for maximum impact. This can involve forming partnerships and networks to share the best practices and resources. Okay, why the collaboration with other organizations is important? Because our organization is looking for financial aid. Collaboration with other organization is important in terms of financial aid and sometimes in terms of exchange of resources as well, and exchange of expertise related to the physicians, the service providers as well. Sometimes such kind of exchange also happens when our organization collaborate with other organization. This can involve forming partnerships and networks to share best practices and resources. Of course, this will happen as a result of partnership only. Prioritizing prioritizing resource allocation based on the level of risk and the potential impact on service users. This may involve identifying high risk areas or activities and prioritizing the resource allocation to those areas. When our organization is not collaborating with other organizations and it is looking forward for the provision of some resources, then of course allocation of the resources is very important. It is important to identify the weak areas, the high risk areas, and then sorting out what kind of resources is required are required for such areas. Okay, then last is identifying health and safety priorities. Identifying health and safety priorities can be a challenging task as there are many factors to consider. The following are some key considerations that can help you prioritize your health and safety efforts. First is risk assessment. Again, conduct a thorough risk assessment to identify the potential hazards in your workplace or environment. This will help you understand the likelihood of and severity of each risk and prioritize your efforts accordingly. Then comes the legal requirements. Ensure that you are complying with all the relevant health and safety legislation and regulations. This will help you identify any legal requirements that need to be addressed and prioritize your efforts accordingly. Okay, so legal requirements, law implementation, it is extremely important because when there is no law, there will be no policy. And when there will be no policy, then no one will follow the rules. Okay, so legal requirement is very important. You need to register your organization. Implement all kind of you need to implement all kind of necessary policies and the laws upon your organization for the proper and efficient working. Employee input. Seek input from your employees regarding their concerns and suggestions for improving health and safety. This will help you understand their needs and prioritize efforts that will have the most impact on employee safety and well being. You will need to seek your employee. Employee is all the administration staff that is involved in the proper working of organization. Okay, so you will need to seek your employee regarding their concerns, suggestions for improving the health and safety. It means that what kind of administration steps can be taken in order to improve the environment for proper health and safety uh, procedures to be provided to the patients. This will help you understand their needs and prioritize the efforts that will have the most impact on employee safety and well-being. Because involvement of your employees not only helpful for the provision of proper health and safety procedures and for the provision of proper treatment plan to the patient, but it also involves the health and safety of the employees themselves as well. Severity of consequences. Consider the potential consequences of each hazard and risk. Prioritize the efforts to address the hazards that could result in serious injury or illness or have a significant effect on the business or environment. Okay. So, when we are going through the process of risk assessment, it is very important for us to analyze that the risk is crucial to which level and what kind of management should be required and whether it will result in some kind of serious injury or illness of the patient or not. Okay. Available resources. Consider the resources available to address each risk of hazard. Prioritize the efforts that can be realistically implemented given the available resources. So, first priority of all the administration staff, the physicians, is to use the available resources for the management of the risk. But if they are insufficient, then of course they will go towards the more adequate resources. And for that, of course, collaboration of the organization and many other things are also involved. So, by considering these factors, you can develop a comprehensive health and safety strategy that prioritize the efforts to address the most significant risks and hazards in your workplace or environment. Okay, so this was all about the risks, the dilemmas, the management of the risks that should be involved in implementation of any procedure or policy in any health and safety workplace. Is everything clear to you up till now, beta, or do you have any kind of question? Do ask me freely, please. Okay, good. Okay, last assessment criteria for learning outcome number two is analyze the effect of non-compliance with health and safety legislation in a health and social care workplace. Okay, so we have just discussed what is non-compliance or resistance in point dilemma number four. So, what is the effect of compliance? Let us have a look. Non-compliance with health and safety legislation in a health and social care workplace can have serious consequences for both employees and the patients or the residents. Some of the effects of non-compliance include increased risk of injury or illness. Yes, because when patient is non-compliant to any treatment plan, is not getting the proper treatment at the proper time, it may result in some sort of injury or illness. Non-compliance with health and safety legislation can increase the risk of accidents, injuries, and illness in the workplace. This can result in employees and patients being harmed, which can have long-term effects on their physical and mental well-being. So similarly, if the persons are non-compliant in terms of health and safety legislation, then there will be more chances of accidents and injuries within the workplace as well. Legal consequences. Non compliance with the health and safety legislation can lead to legal consequences, including fines, legal actions, and reputational damage. This can have a significant impact on the financial stability and reputation of the workplace. Okay, so non compliance with the law, with the legislation, it means you are not complying up with the policies that have been implemented in the workplace, as a result of which you may suffer some kind of fines, some kind of legal actions. You have to go through the reputational damage as well, and of course this will also result in financial instability of the workplace as well. Staff absenteeism and turnover. Non-compliance with health and safety legislation can lead to increased staff absenteeism and turnover. This can result in increased cost and associated with recruiting and training new staff, as well as a decrease in productivity. Because when staff will remain absent from the workplace for some kind of reason, maybe they are important, maybe they are not important one, then it will result in hiring of more staff, as a result of which, of course, the workplace will also suffer from some kind of financial instability, and there will be decrease in productivity. Because the staff keep on changing, keep on replacing each other, they will be unaware of what kind of procedures are going through for a specific patient, what kind of treatment is given to a specific patient. Damage to workplace reputation. Non-compliance with health and safety legislation can damage the workplace reputation, both within the industry and with the public. This can lead to decrease in referrals, revenue, and the ability to attract and retain high quality staff. If the workplace, the workers, the employee, they become non-compliance with all kind of legislation, all kind of policy, it will of course damage the workplace reputation within the industry and the public as well, and this will of course lead to the decrease in revenue generation. Why the revenue will generated will be lesser? Because the reputation has been spoiled, the trust has been decreased. Now lesser number of patients will visit your organization, so you will suffer through revenue generation as well. Increased insurance premiums. Non compliance with health and safety legislation can result in increased insurance premiums, as insurance providers may view the workplace as a high risk. This can lead to additional financial costs for the workplace. Okay, increased insurance premiums. When there is non compliance with health and safety legislation, it will result in increased insurance premium. Okay, as insurance providers may view the workplace and they view that it is at high risk, so of course insurance premiums will be increased. It means non-compliance with health and safety legislation in a health and social care workplace can have serious consequences for both the workplace and its employees, with patients and residents. It is therefore crucial that the workplaces prioritize compliance with the health and safety legislation to ensure the safety and well-being of all involved, and all includes the employees as well as the patients. Okay, so this was a bit all about the learning outcome number 2. We have completed it. So what is the learning outcome number 2? Understand the ways in which health and safety requirements impact on customers and the work of practitioners in the health and social care. So we have completed this. If you have any kind of question, do tell me, please. Okay, good. All right. Okay, can you please tell me how does risk and benefits go side by side in any procedure? How we will analyze our treatment plan depending upon the benefits as well as the risk assessment, risk management. How we will decide that we are going to give priority to one treatment plan upon the other when both the treatment plans are having benefits as well as the risks. No, you have to tell, okay, in simple way, I'm asking you, if you are having two pair of shoes, okay, this condition will be termed as dilemma because you have two pair of shoes and now you have to decide which shoe you will wear. How will you decide? Depending upon the comfort level of the shoe, depending upon its appearance, okay, and depending upon on your choice, yes, of course, and quality as well. So in this case, you are going to decide, you have to decide between the two treatment procedure. So how will you analyze that which procedure you are going to select for the treatment of a patient? You will see its benefit, the side effects, the choice of the patient, whether the patient is ready to take the injectables or the oral medicines. Okay, so it's simply the answer is depending upon the benefits and the side effects of the treatment plan, we will decide that which treatment plan should be given priority above the other. Okay, is it clear to you? Okay, all right, good. So, beta, this was all about today's class. If you have any question, do tell me later, or if you have any question right now, you can tell me now. And inshallah, see you in the next class. I have checked your assignment and sent back to the administration, and you have written it very good, very in a very efficient, you can say professional way. I'm highly impressed. So I'm looking forward that you will write all your assignments for this subject in the same way too, inshallah. Okay, beta. Thank you so much. Take care of yourself. Allah Hafiz.